Ann Byram, and I serve as the State Director for Protect Our Care Michigan. Protect Our Care is leading the fight to protect and strengthen the Affordable Care Act, which increases access to health care for millions of Americans. I'd like to start by thanking the Michigan Democratic Party for inviting me to join today's conversation. 55 years ago, President Lyndon B. Johnson signed Medicare and Medicaid into law. These programs are critical lifelines that have done a lot to improve the health and well-being of Americans. Despite the proven benefits of Medicare and Medicaid, President Trump and Republicans continue to do everything in their power to undermine and cut these programs. Much like the Affordable Care Act, Republicans want nothing more than to gut or outright eliminate these critical programs. It seems that nothing will stop the GOP in their war against the Affordable Care Act, not even a global historic pandemic. COVID-19 cases continue to rise and millions of Americans continue to struggle. Our country is facing a public health crisis and an economic crisis. And yet, President Trump and his allies have decided to spend their time pushing a lawsuit against the ACA as millions of Americans fight this terrible virus. As we approach the November election, one thing is crystal clear. Access to quality, affordable health care is a top priority for Michigan voters. The stakes are very high, and COVID-19 has underscored the importance of high quality, affordable health care for all Americans. We need allies in state government, in the U.S. House, the U.S. Senate, and in the White House to ensure that never again will our health care be threatened in the way it has under the Trump administration. And chief among those allies is U.S. Senator Gary Peters. Senator Peters has been a champion for the ACA from day one. He's worked hard to protect and improve the Affordable Care Act that benefits millions of Michiganders. 1.7 million Michigan residents have pre-existing conditions. Almost 1 million young people who are now able to remain on their parents' health insurance. And every senior citizen on Medicare has benefited from the ACA by having cancer screening tests covered, immunizations covered, and the elimination of the donut hole, which reduced the cost of prescription drugs. However, John James clearly stands with President Donald Trump and Republicans in Washington, D.C. James has called the Affordable Care Act a monstrosity and has vowed to work his tail off to remove it. And the bottom line is, he has no plan to protect people with pre-existing conditions. He's with Trump and McConnell 200%, not with Michigan citizens. John James has yet to reveal a plan that ensures millions of hardworking Americans don't lose their health coverage. Those with pre-existing conditions can get coverage that not only covers their pre-existing condition, but is affordable. With these critical protections at stake in the November election, Michiganders deserve to know the details of John James' health plan. So much is at stake in this election. That's why right here in Michigan, we need to work incredibly hard to make sure we re-elect U.S. Senator Gary Peters. Thank you, and with that, I'm going to introduce our next speaker, State Representative John Hoadley, who is a candidate for Congress in Michigan's 6th Congressional District. Representative?
Well, thank you. And thank you everyone for being here today. We are reminding folks just how critically important Medicare and Medicaid are for millions of Americans. And as a state representative, I have stepped up to the plate to protect healthcare over and over. And in Congress, I'll continue fighting for folks who depend on Medicare and Medicaid. And I'm running against Congressman Upton, who has voted for cuts to Medicaid and wanted to raise the eligibility age for Medicare. And this is exactly the opposite of what we need. when we saw Congressman Upton vote against prohibitions on the reduction of eligibility or benefits or for seniors or individual with disabilities, it showed that he yet again will continue to vote in the wrong direction for when it comes to Michigan families. One thing that now in the crisis we're in is showing us, it's that we should be expanding Medicaid and allowing Medicare to negotiate prescription drug prices to ensure that people are receiving the best possible care. Given the chance, Congressman Upton voted against allowing Medicare and Medicaid to negotiate for lower prescription drug prices by voting against H.R. 3. Now, in the State House, I've actually authored resolutions that would call on Congress to have the authority to allow Medicare and Medicaid to negotiate for lower prescription drug prices. And that's important to so many Michigan families and millions of families across the country. And I've told my healthcare story before, but I'll say it again. You know, when my partner, Chris, who has multiple sclerosis, when we are going through every January and hoping that the prescription drugs that keep him healthy remain affordable and remain on the plans that are being offered by his insurance companies, it just shows that we need more leverage, more power for consumers so they don't have to make difficult choices between purchasing the prescription drugs that keep them healthy or paying the rent or buying groceries. And unfortunately, this choice keeps getting harder for millions of Michigan families. So now more than ever, in the midst of the pandemic, we should be prioritizing quality, accessible healthcare for all Americans. And that's what I'm going to keep on doing when I serve in Congress. Thank you. And for a man who has been doing incredible amounts of service in fighting for Michigan families all across the state, I'd like to introduce the Lieutenant Governor of the state of Michigan, Garland Gilchrist.
Thank you very much, Representative Hoadley, who I currently refer to as State Representative, and am excited to soon refer to as United States Representative John Hoadley, representing soon to be the 6th District of Michigan. Thank you for your service and your leadership. Diane, from Senator Diane Byram, I want to thank you as well for your leadership and service and advocacy and being a deep well of information and perspective on these important issues when it comes to healthcare in our state and in our country. You know, it should be obvious why we want to talk about healthcare in the midst of the greatest global public health crisis in more than 100 years. What I want to start with, though, is actually the things that we can look to for inspiration in this moment. We have seen so many people in so many communities come together to have each other's back, to help one another out. We've seen whether it's, you know, the people who have to do it because it's their job, the nurses, the nurse practitioners, the bus drivers, the utility workers, working long hours in dangerous conditions, the teachers who are trying to write curriculum and pack lunches and take care of their own family and think about what they're going to need to do at work, to the companies in Michigan and those leaders who have decided that they could retool and they could shift their manufacturing processes, whether you are a brewery now making hand sanitizer, to an auto supplier making face masks, and everything in between, switching up to meet the needs of the people of Michigan and the needs of the people of the United States. You know, our ability to come together means that in Michigan, we can overcome anything. And I think Americans can overcome anything when we have the right spirit and the right attitude. And that's coming together, and that's making sure that everyone has what they need, not just to survive, but to thrive. And I'm proud of Michigan's role in that overall in the country. You know, but there are some things that, again, are really clear and really obvious right now that we have to maintain perspective on. First of all, we know that this is the time to expand access to healthcare, not to restrict it. And frankly, bluntly, there is one party that's going to be before you that is unequivocally focused on expanding access to healthcare. That is the Democratic Party. Whenever you need to think about who's going to vote to get more people healthcare, think about Democrats, because that's as far as you need to go. There is not a Republican on the ballot who is going to be looking to expand access to healthcare. They're going to want to cut people off who have pre-existing conditions. They're going to want to make healthcare so expensive that it is untenable and not realistic for people to be able to get it. They want to cut people off in the midst of actually getting healthcare by reinstating things like lifetime minimums and things like that. This is why it's been so important to our administration, as I serve alongside Governor Gretchen Whitmer, a woman who, when she was in the state Senate, fought and negotiated the expansion of Medicaid in the state of Michigan with our then Republican governor because it was the right thing to do to roll their sleeves up and get to work. we announced before COVID a series of policies that would codify many elements of the Affordable Care Act into law in Michigan, because we knew that we needed to protect the ACA and ACA beneficiaries in Michigan from President Donald Trump, who has been focused like a laser on gutting the ACA. They're still trying to sue to kick people off their healthcare who have pre-existing conditions. And this Supreme Court, I do not expect to be our friend on this issue. So we need to continue to advocate. We need to make sure that we are electing and appointing leaders who are about expanding access, not about constricting it. And that is why it's so important that Joe Biden is in office. Remember, Joe Biden was the one who helped to do the legislative negotiations to get the ACA across the finish line in the first place. And the healthcare plans that he has announced, along with being the most progressive healthcare plan ever put forward by a Democratic nominee for president in the history of Democratic nominees for president, Joe Biden wants to make sure that not only do you have access to healthcare regardless of whether or not you have a job, not only to expand a public option to make it available for people to have something that's an alternative to private insurance to be possible for people to get, but to also just make sure that we can negotiate prescription drug prices, something that is a devastating expense for families and individuals, certainly across our state and also across the country. We also have to recognize that part of that mirror that was shown in the country, we had to look in the face the racial disparities that have been laid bare as part of the COVID-19 pandemic. These are not racial disparities that COVID created, but they are disparities that COVID has exacerbated. And I'm speaking on this from personal experience. I have lost 23 people in my life to COVID-19. These have been people from family members to basketball coaches to people I used to work with to friends I grew up with. This is real. All of these people have families and stories and legacies, and we need to honor them. But the way to honor them is not the way the Trump administration and Republicans in Congress and in the state legislature have chosen to do that. They've chosen to ignore COVID-19. The Republican Party in Michigan, their position, to be very clear, is that there is not a public health emergency currently happening, even though we have people getting sick and dying every day here in the state of Michigan. The Trump administration is actively turning away and saying that things are progressing as millions of Americans get sick and hundreds of thousands of Americans, more than 100,000 Americans have passed away. So we have work to do to also make sure that our most vulnerable populations, communities of color, the Black community, our migrant workers, et cetera, those who are vulnerable because of the jobs they do, because of the environments that they live in, because of the circumstances in which they have to fight with poverty every single day, because of the fact that the discriminatory practices of the healthcare industry historically has led to a lack of access in certain communities. This is what we must overcome. And so our administration, through my coronavirus task force on racial disparities, has looked to address not only the immediate issues, but also those long-term and systemic issues that are working to right those wrongs. When we think about what is before us, what's the opportunity that we have, what is at stake, we have a chance to make a generational choice. We can make a choice on the direction that our country and our state is going to go. Are we going to choose to create more opportunity? Are we going to choose to invest in the public health and public safety of more people? Are we going to choose to widen the pathway to the pursuit of happiness for more Michiganders and for more Americans? That is the choice before us, and that's the choice that everyone will make when they cast a ballot for the Democrats, when they cast a ballot for Joe Biden, when they cast a ballot for Gary Peters, when they cast a ballot for John Hoadley. By doing this all across the state of Michigan, we will send a strong signal and a strong message to the entire country that Michigan is about progress. Michigan is about access. Michigan is about opportunity. And that is something that I'm very excited about. I'm ready to work my heart out to make sure that every Michigander has the opportunity to make that statement at the ballot box as safely as possible. Because when we do that, when we stand tall, when we lift our voices in that way, we cannot be ignored, and we cannot help but succeed in expanding opportunity, healthcare, and success all across the state, and then have that reverberate across the nation. So again, thank you for allowing me to be able to be part of this conversation today. It is critically important, and I'm ready to get to work.